Hey guys, this is Dr. Bhupesh once again for you all to record what we have learned today. Obviously, we will do one or two questions more, but it's just to brief what we have learned today. So first of all, the major thing I always say again, I'm not here or Dr. BKM is not here to teach you about tricks and tips and tricks. That is what you call it. We are not here to teach you that because trips I don't know even how to say tips and tricks can fail because tips and tricks means you want to know something that is a shortcut. Sorry, there is no shortcut. If you want to pass 100%, there is no shortcut. You have to understand. So it's not the tips that I am here to discuss, it is the technique. So the first strategy or the technique to do OET reading is to do only easy questions first. Again, this thing I repeat every time when I record the video, even when I teach you. Every day I tell you that only easy questions should be done first. Because suppose if you have an exam of 45 minutes, you all know that we want to spend our 30 to 35 minutes on the question that can be done. So that means we want to spend our major time on easy questions. That is the main thing. If you will start believing this statement that I have to do only easy questions, that means your exam cannot be difficult because difficult questions you will leave in the first round. And you will understand, sir has told us that we have got 30 minutes to solve around 12 to 14 questions. I have to find just 12 to 14 questions. My job today is to find 12 to 14 questions which are easy in 30 minutes. Then I will have 15 minutes to find 4 to 5 questions which are in my range but difficult. So that means in the first round, if there is any difficult question, but it is in my range, but it is taking my time, I leave it. That means I never give my time in the first round. I do only easy questions. That is the first technique. Then it comes to the other things we learn. That today we have learned a lot of things. So I'm trying to cover all those important things from questions. Again, Dr. BKM's job is to teach you how to do it. And again, we are taking it from the authentic reading. So I'm just trying to cover what is important and how can you do it. So obviously the material is created by E2 language. We appreciate. Now this was the question we were doing. So this was these two questions we did, very smart questions and very nice as well. This was the easiest. In the second paragraph, writers suggest that GP should. Suggest means should. Suggest means should. So anyhow, even without reading, if you understand that suggestion is given in should, so you can reach up to this. That is how easy you can make your OET reading if you understand small things about it. That GPs should word is given. And if you read from the paragraph, then you will become even more familiar that while GP should have this, GP are well placed, they were asking suggestion. So in the first, they were saying that GP often face problem with the patients who do not get better even after using psychological therapies. So in the first line, the author is not giving suggestion. He is giving a situation where the patient is not improving. GP are well placed in one regard as they have a. So now he's saying he's again giving information. He's being informative that GPs are better because they have the longitudinal study. They know the history, everything. Of course, GP should not soldier on alone. That is, GP should not soldier on alone if they feel that the patient is not getting better. That is the only suggestion, that they should not give the treatment alone if the patient is not getting better. That is exactly the same point. What can be easy than this? That is exactly the same point. Should seek help when treatment plans are ineffective. When patient is not getting better, you seek help. You don't shoulder. You should not soldier on alone. You should seek help. So how can it be easier than this? That is what you need to learn to find easy question. Now, was a very smart question again. Results of the study. So don't focus on anything, just focus on the result of study. So if you read this paragraph, then in this paragraph, if you will see guys, again, simple. I will rub it. I will take it again. A qualitative study was taken. It was found It was found means in that study it was found. That means this is the result of the study. It was found that while there was confusion around the exact meaning of the term, GP could relate it to broadly encompassing a range of individual and presentations. That means GPs did not have the exact meaning of this term. It was a broad term that was encompassing a lot of individuals, and there was no meaning of this term. There was no exact term. There was no exact meaning. So then we went on to the options and we could relate it very easily. Again, elimination you can do, but these are the simple questions. And again, the main thing was results of the study. It was found that difficult to treat depression did not have an exact meaning. That means it lacked a precise definition. The term did not have that, it was a broad term. So then you start finding these easy questions and you don't overdo. In these questions, we don't have to overdo things and we don't have to overthink. Again, if we discuss about the part B of today, this question was also a wonderful question I wanted to record. Wonderful question. What is the purpose? When we are talking about a purpose, don't read everything. Purpose would always be here. That is the main point. Special measures may be needed to ensure everyone in your client base is aware of the consumer feedback. Consumer feedback means like you are my clients, you are my students. Sorry, if I say you are my clients, you will give me the feedback. And everybody should be comfortable with raising their concerns. That means every one of you should be able to raise the concern. For example, should you provide brochures in English? That means there is a question. Should you provide a brochure in the language other than English? That means if the patient is French, then you give the information in French, you give the brochures. That is a question. Then they are talking other examples. For some people are less likely to complain due to cultural reasons. For example, Aboriginal people may not complain. People with certain conditions, hepatitis B, may have concerns about discrimination. That will make less likely to speak up. Less likely means they might speak up, they might not. Less likely means less chances are there. Chances means may. Now, if you will see the options. To illustrate situations, illustrate means to give examples. So examples were given and situations were given. Cultural, Aboriginal people may find it difficult. Certain conditions when people have hepatitis, there were various situations given. So you understand, I can eliminate just because of the word negative feedback. Then you read it carefully. Aboriginal people are less likely to complain. Complain means negative feedback. Complain does not mean positive feedback. People with certain conditions may have concern about discrimination. They are less likely to speak up if something is wrong. If something is wrong, of course, negative feedback. So there were words given even for the negative feedback. Then the special word was may. This you have to understand. Options with may has the higher probability. And then you notice the same grammar. Less likely means may. Aboriginal people may, less likely. Then you understand this is also given. Then you understand A has a very bright chance. Then comes the elimination. Again, technique. Otherwise, your answer is done. Simple. If you are not overthinker like me, then to it's simple. Then you said to argue that hospital brochure should be provided in many languages. They were not arguing, they were asking a question. That is what we did in the last question. Suggestion means advice. In the same way, question does not mean argue. There was no arguing. Again, the main purpose means main point. To provide the guidance to the people who are victims of discrimination? No. They were not talking about people having discrimination. They were saying people with hepatitis B or mental illness may have concerns about discrimination. So they were not talking to the people who are victims of discrimination. They were talking to the people who were having hepatitis B. So there were no people who were victims of discrimination. Then other point, provide guidance to the people. No, the main point is to provide guidance to the staff, to the nurses, that special measures may be needed to ensure everyone in your client base. That means everyone of your patient should be able to. So this paragraph was for nurses, not for the people who were discriminated. So obviously this was not the main. Many ways to eliminate. So these questions should never be wrong. Argue, no. Provide guidance to people, no. Provide guidance to the nurses, that you should encourage the people to give the feedback. As in many negative cases, people will not give the feedback due to various situations. For example, So the major topic was talking to nurses and staff about motivating their client base to participate in the feedback if they have any complaints, so that they can participate. So various situations were given. So that is how you do OET reading. And please again, listen to this recording 10, 20, 30 times, closing your eyes. Trust me, I'm not exaggerating. If you will close your eyes, will listen to it, your subconscious will digest it. Till the time you are in the conscious mind, you are arguing, you are not learning. You also argue to anything that is, suppose if you believe in something, I try to change you. So obviously you will feel, he's arguing. But if you say, no, 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 he is our mentor, we need to learn from him, then your mind does not argue. Then you let it digest. And then you understand. The first technique is do only easy. That means you want to spend 30 to 35 minutes on the question which you can do. Any question that you cannot do, don't worry about it. Even if they are 6 or 7 in number, nothing to worry. If there are 6 difficult questions in your exam which you do not understand it at all, it's normal. That means you still have 16 questions in the part B and C, which you can do right. If out of 16, you can get 12 to 14 marks. Out of difficult questions, if you get 1 or 2 tukkas by elimination method, you will pass. So that is the whole story. Again, this is Dr. Bhupesh from Dr. BKM OET Institutes. Recorded what we covered today. We covered more, but again, I don't want to stress this video too much. Thank you very much.